This is Michelle Hasan. I'm on the board of Ombudsman Services. My professional career has primarily been in the nonprofit and public agency sector around providing services to the most vulnerable persons in our community. The work of Ombudsman Services fits that focus. Being the voice of seniors who may be isolated from family members and holding those responsible for their care to the highest standard and accountability is important work. My father was a resident of a facility since 2018 after a fall in a medical procedure. His facility was locked down early March and for the most part had stayed clear of any infections until June. Prior to March, myself and my siblings visited my dad no less than 4 to 5 times a month. We could see him, we could talk to him, we could hug him, we can bring him gifts and food and spend as much time as we wanted. In March, late March, he was diagnosed with pneumonia, and he did test positive for COVID in June, which meant he was in isolation for 2 months. No phone calls, no visitors. We were not able to see him or talk to him or hear his voice. On July 18th, my dad's health declined further. His nurse at the facility called me, as she did weekly, and asked me if I'd like to have a visit with my dad via an iPad. Of course, I was happy to have that connection. And we talked, and he looked up at me, and he saw me, and he heard my voice, and he spoke to me for 15 to 20 minutes. But he was very weak on that day. On July 21st, my dad passed away. 2 weeks earlier, my brother and his family had also had the opportunity to visit with my dad via an iPad. Again, the technology is so important to residents in these facilities. Having had that last bit of time with my father via that technology, that iPad, was priceless, and I will never forget it. Every resident should have that opportunity to communicate with their loved ones, even if only to see them on the screen or hear their voice or talk to them. My commitment to this campaign is a personal one, and I hope others will join me by contributing whatever they can to our efforts to raise $20,000 through the Travis Credit Union Matching Gift Campaign. I'd like to share some of my proudest moments with the work that we've done at Ombudsman over the last year. Certainly our expansion to Alameda County, serving an additional 15,000 residents and 350 facilities, was a great accomplishment. But of course, it was overshadowed so quickly with the onset of COVID. Frankly, it has been the last 6 months to see the fierce commitment of our executive director, Nicole Howe, getting the word out about the needs of long-term residents locally, at the state and federal level. Our support in distributing personal protective equipment to staff at long-term care facilities, the Ombudsman staff who continue to work even if remotely to be flexible and get the job done each and every day, and our board president, Emily DeFala, and co-board members who have a vision, who have creativity and can bring new ideas into reality. I'm very proud to say I'm an Ombudsman board member who works on behalf on seeing these seniors get served. And I really thank you for your generosity and support of this campaign. Please give what you can.
To help us raise $15,000 in the Travis Credit Union COVID Relief Initiative, you will help lift the voices of older and dependent adults in our community. You will help connect them with friends and family and ensure access to their long-term care ombudsman when we can be there in person. Visit https://bit.ly/TCU Fund Ways to Give and select Ombudsman Services of Contra Costa, Solano, and Alameda as your organization of choice from the drop-down menu. And thank you for your support.